Thank you so much for having us here talking today. My name is Josefine Magnusson, and I'm the Senior Research Officer at Future Care Capital, which, as Alice said, is a health and social care charity. We have a particular interest in data, innovation, and technology as it relates to health and social care. So our work on social care data, just briefly, we have done a number of projects in this space. We've been looking at things like provision of care and stability of care home markets. We've been looking at unpaid carers. We've started to do some work around self-funders and how best to identify those in the collaborative piece of work that we're doing together with the Office for National Statistics. And that is something that that project will be feeding into the community of practice as well, and we'll be taking advice from there. We did earlier in the year start putting together a social care data finder, simply because the lack of data sets in social care, but also the lack of link up between the sets that already existed, it was hard to find. So we put together this finder in order to better sort of provide a space for where you can look at different types of data provided by central and local government. And like Ellen said, we've developed this work further into collaboration with Health Foundation, where we've been undertaking the workshops and webinars that led up to the development of this community of practice. So the community, which actually launched yesterday, is bringing together people from all range of areas that are looking at social care data analytics. So we have people who are data analysts, researchers and academics, policymakers and practitioners from both private, public and charitable sector, and also people working in technology development in relation to social care. We also have this community for people who do have lived experience of social care. And as Ellen already said, one of the key questions that has been identified through the work that's already been done is to understand the lived experiences of people who are in need of social care. And the other key topics that we are focusing on as a starting point for the community is to improve the quality of care for cohorts of people that experience the worst outcomes, and how to build a safe and resilient workforce. So the work that's gone into developing this community, we have been taking these key questions that were already identified and been looking specifically at trying to identify data gaps relating to these areas and examples of good practice. So in the run-up to the launch of the community, we invited people working in the space to contribute via a survey, and we have examples through that we will be sharing via the community as it develops. Content that in relation to the community will be hosted on the community webpage, and the first link that you see under the picture there is the link for the community webpage. We will have links to events, blogs, and other types of content there. But the place where the discussion will be really happening is a discussion forum, and the second link under the image that you can see there is the link to the discussion forum, which is a discussion board where topics will be posted. We have started off with the ones that are already identified, but community members are, of course, welcome to identify their own topics and start their own conversations and join in there. And I do think I'm right in saying that these slides are going to be shared, so you will have the links for both the webpage and the discussion forum easily available after. So both Future Care Capital and the Health Foundation will be linking in with the community in terms of the work that we are doing, but it's important to say that the community is ultimately driven by the members. Now in the beginning part, we will be forming some of the conversations and driving some of the events that are happening, but we are hoping that the community will ultimately be running itself and will be led by members, and that is the way that it should be. So the activity that we're hoping for in the coming months, or that we're planning for in the coming months, is to have development of an independent community leadership team. And again, that is something that should come from the membership and the people who are joining it. We are looking at co-producing a set of norms around how data can and should be used within social care. We are developing a way of agreeing a set of priorities that describe how people who work in social care data could work together to achieve vision for a better social care analytics. So we have a clear kind of program that we're working towards. And we will also be organising virtual events for community members, and we have a few of those sort of in the pipeline, but we're also looking to community members themselves to come up with either ideas for events or to share events that are relevant for the community within the community. So I would encourage everyone who has an interest in this space to hop on board, to come and join us. You sign up to the discussion forum using the link that is provided below. And if you have any questions about that, feel free to email myself for further details about that. But it's really about getting people together to be part of a network with others working in the field. And we've had a really great interest in this space already. So for our launch yesterday, we had close to 100 people attending, and we had people from a really wide range of backgrounds coming along. So we had people from local government, policymakers, academics, people with experience of care. So the whole spectrum really. So it's looking to, right from the outset, be a really vibrant and diverse community. And I'm looking forward to seeing as many of you as possible there in the near future. Thank you.